Good afternoon, everyone. I'm Jeffrey Braithwaite, and I'd like to welcome you all to our Partnership Centre in Health System Sustainability. You'll hear the acronym PCHSS throughout the afternoon, and it's our workshop on creating a value-based integrated health system in Australia. I must say at the outset, I can't help thinking about this topic area without thinking with my hands value-based, which is kind of a deep appreciation for the care that might be delivered, and integrated care, which is joining up all the silos that we know exist between general practice, acute care, residential aged care. So I kind of think value and integration is a sort of more horizontal thing. But anyway, that might be just me. Please submit your questions as we go along throughout the course of the presentations. And what we'll do is try and address them as we go along and have a discussion at the end. I'd particularly like to thank the people in the PCHSS who made this happen, Genevieve and Kaylin and Yvonne, already have met or will meet at various times, but they're staying out of picture between Annette and I just at the moment while they do the background work to make this thing work. May I, in this introductory bit, acknowledge country and just change the slide to acknowledge country. I'd like to acknowledge the traditional custodians of the land from which all participants are joining, and we're joining from different parts of the country. I'd like to pay my respects on our collective behalf to their elders, past, present, and emerging. I'd like to extend that respect particularly to Aboriginal and Torres Strait Islander people with us today. So, what is the NHMRC, National Health and Medical Research Council, funded and sponsored Partnership Centre for Health System Sustainability? Many of you know this, but I'll just briefly touch on this. Firstly, the picture you see is the inaugural meeting we had. We kicked it all off. It's a $10.75 million 5-year collaboration. It has 17 lead investigators. They tend to be people in the health system or people who are full-time researchers, or sometimes a combination, 20 expert advisors, and 40 system implementation partners. That's people in the system who we reach into and with to try and create change and improvement with our research. And they come from around Australia. I'll show a map shortly. I'd like to acknowledge the Partnership Centre is supported by the following funding partners who need really no introduction: NHMRC, Bupa Foundation, Western Australian Department of Health, University of Notre Dame, and New South Wales Ministry of Health. And we'll be hearing from people from around the country and from various various parts of our funding partners as we go through. Just so you get an impression of the scale of that, the Partnership Centre sponsors and funders are one thing, but the reach and scope of this is pretty massive. It covers every state and territory. We span not just the states, but the Commonwealth. We also have a bunch of people in each state who are often researchers in their own right who joined us. And they do their own research, their own funded research, but also part of their research is to look at how do we create a more resilient, ongoing, sustainable health system. We're guided by an international advisory group of pretty stellar researchers in their own right who we consult with every year or so. We also have a scientific advisory committee, but the most important group for us is the group we report to, which comprises the funding partners and the sponsors, and that's our governance authority. And that has representatives from the funding partners and from NHMRC. And they approve our work plan and provide governance input for us to make good progress. So in a nutshell, this is our vision. You don't need for me to read it to you. In a way, I'm going to come back just by explaining the reach and extent of the involvement of the Partnership Centre in the life of the Australian health system. Our job is to try and contribute through research to a better health system, one that's constantly improving and is resilient. I love that word. It's a fantastic word. It means that it has the capacity to deal with everything that we might throw at the health system and bounce back and do well. And if there's one thing in recent 2 years that have proven that, it's COVID-19. Continuing to deliver improved health outcomes for Australians during very tough times. So the purpose of the Partnership Centre is to do research, translational research, to get ideas, evidence, frameworks, tools into the hands of people who are responsible for the performance of the system so that we can do more efficient, effective healthcare. And the end result, of course, is better care for patients. So this is about improvement. It's bringing people together collaboratively, joined at the hip, to provide that improved health system that we all want, and sometimes see and sometimes know that it can be improved further. So in terms of concrete things, 3 research areas were when Christine Bennett and Annette Schmiede had the brainchild and worked with NHMRC to create the Partnership Centre all those years ago. They thought 3 things would be important for us to focus our research on, and that proved, to be frank, it's not just because Annette's sitting next to me, to be prescient, because those things haven't gone away, and in fact, probably across the 5 years we've been doing this, they've loomed larger in importance. So the research we do to underpin this has proven to be very important, we think. So there's analytics, technology, and shared data, tackling big questions around how do we harness data, artificial intelligence, new data, how do we do analytics, how do we tap the technology that produces all that data and feed that into a better performing health system. Secondly, reducing waste and low value care. We like to say that we'd like to guarantee that every single dollar spent in the health system was valuable. It wasn't futilely spent, that it wasn't wasteful, but it produced value for patients. And better value for the health dollar extends that further by saying, can we get an economic appraisal on this? Can we understand this from a health economics and financing point of view? Can we drive that better health dollar, reduce waste, provide better value care, but with a real economic edge to it? So those are the 3 things we're trying to do. We also have an observatory on health system sustainability. This was originally the people who were in the centre, such as Yvonne Zorinsky and Kayleen Smith originally, to really observe what's happening nationally and internationally and feed that back into the researchers and the system to try and have this ongoing improvement that we like to think when we use the words continuous improvement. Okay, that's enough from me. We're going to have coverage from Croakey, from Amy Coops, who is on behalf of Croakey going to write some of this up and especially tweet as we go along on the tweet We Public Health and also hashtag value-based care. So you'll see Amy Coops at Coops Detat, who is going to you'll have to tell us what that means. Amy, it has some mysterious meaning that we haven't figured out yet. Coops Detat. Maybe that's your surname? No? Or another name you have? Anyway, you can unfold that for us another time. And we're going to be hashtagging and tweeting from those perspectives. So we build up a community who can't come to share ideas. So that's enough from me. I am now going to hand over to Annette. I'm going to come out of those slides. Now, Annette was, as I said, I'm handing this back to off-screen to Kayleen, who's making this all work. Annette, you were one of the architects of the original thinking around and created the original thinking around the Partnership Centre. Thank you for that. And over to you.
Thank you, Jeffrey, and hello everyone. Delighted to be chairing today's first session towards value-based healthcare, shifting from volume to value. Well, the partnership's certainly humming along. The audience, we've already indicated that Partnership Centre actually goes back some time. And when I was going into the records at Bupa when I arrived in 2014, it was actually approved by the NHMRC in 2013. So you're absolutely right, Jeffrey. The organising framework, those three themes, have proved to be absolutely, we were ahead of our time, or to be fair, Christine Bennett and the groups that were working with her were ahead of their time, particularly theme 2, promoting better value care. And I think it's even more relevant today in 2021 than it was, when we started in 2017. It did take us a little time to get started, but here we are into year 4.
And analytics too. I mean, look at the advances we've seen, say, from Enrico's group on artificial intelligence. Exactly. And the work on Paul's group on low value care. So it certainly helped. It was already ahead of steam, as you say, but it built ahead of steam much greater than it would have been.
Totally. So maybe that time in gestation was actually proved to be worthwhile. So today I've been asked to briefly reflect before we go into our session on what is value-based healthcare. It's a bit of a tall order in a few moments, but I think by the end of our session today, with the fantastic lineup of speakers we've got, we'll be much clearer on this. But in preparing for today's session, it actually, I reflected on my own journey around value-based healthcare. In actual fact, I've been fortunate over the years to undertake a number of study tours, particularly in the US, and a number of them have had a value-based healthcare focus. My first visit was in 2012, it was very much the early days in thinking about value-based care. Michael Porter had come out with his book in 2006, and we were all talking about the very simple equation, V equals outcomes over cost, right? So it was a very kind of simple, elegant equation that we all kind of thought was very exciting. There was certainly an efficiency focus at that time, but what I've seen over the years is we're really been shifting more to thinking about outcomes, and we're really now focusing on what are outcomes that are particularly important to consumers and around that patient focus. So we've seen quite a bit of development. I actually went back on another trip to the States in 2017 when I was working at Bupa, and of course we had Obamacare, we had the Affordable Care Act. So we actually started to see, development and maturity around, the concept of value-based healthcare. And what the US government did at that time, particularly through its Medicare and Medicaid programs and the health insurers, they started to fund things, not everything, but a proportion of what time or funding was to be outcome measured. So that was a big, you really started to see a big uptake in the thinking around how do you identify outcomes, how do we measure them, what are the experiences, et cetera, more nuanced. We started to see much more nuanced. The interesting thing at that time, in talking to providers at that time of great change in the US, they saw it as quite a heavy administrative burden, mainly because you have multiple providers or funders in the US, and so they were dealing with each funder who may have had a different approach to how they were going to be measuring outcomes. So, but what the other thing is that it did drive was a lot of innovation, right? We saw a lot of innovation being driven out of that shift, particularly in mental health. So I guess they're the things that, that we might want to think about for the work that we're doing here in Australia. Anyway, moving on to today's session. The reality, healthcare is a volume business. I sit on one of the local health network boards here in Sydney, and I'm telling you, it is a volume business. These are very big organisations, particularly our public hospital system, with our EDs that are the front door to the system for many people, and they're open 24/7. So, you've got this constant flow coming through all our services. The numbers who use our health services are huge, and the work is complex. So moving to value was conceptually agreed will be introduced through value-based healthcare and the funding, and through many initiatives that you're going to hear from today. It's quite widespread. We've got a number of initiatives occurring, and that will be clear today. But we've had no really big, what I call a big bang solution like we had with activity-based funding. And I think that's entirely appropriate. But I just think that we need to keep in mind that we do have quite a lot happening, and managing to bring that all together and filter out and support the system in taking up and scaling up, I think, is one of the things that we need to be mindful of. So, as I said, we're seeing a lot of nuancing. The approach we're definitely seeing in Australia, and that's been quite clear when you go back and read the literature and see what the initiatives are that are occurring, that we have a very much a focus on the patient experience. What outcomes matter, what has been the experience. George will talk more about that from the New South Wales Ministry of Health perspective. But we'll also be hearing, this is really the approach that we're seeing from funders, mainly government, right? So in Australia, we're seeing the funders, government, moving in this direction, right? But I'd like us to sort of also think that insurers are a big funder of healthcare in Australia. And I know that there's a lot of interest and keenness to be working around that. But the health insurance industry is extremely regulated. And, I think one of the things that might be on the table is there a way of creating a little bit more innovation in the way that we are funding health services through the insurance system? Ultimately, though, the government is the major, both state and federal, are the biggest funders of the system. So the initiatives that we're talking about today, we're going to cover workforce, economics, technology, and policy. My last comment, though, comes from my role at the moment as Chair of Research Australia. It's really critical that we build an evidence base for value-based care. And certainly there's evidence of that today that that's what we're doing, the work that the partnership centre is doing. But we really need to keep that in mind, that the evidence that we are identifying is then used to inform policy, changes in practice, and how services are delivered to the consumer. So today is a great start for that conversation. And I'm going to move now to invite our first speaker, who really needs no introduction, Paul Glacio from Bond University, who's been presenting on the role of health professionals and consumers in reducing overdiagnosis and overtreatment. Paul, I'm going to invite you now to take us through your 10 minutes on the roles of health professionals and consumers in value-based healthcare.